personally don't perform brow lifts in the traditional sense. And what is a traditional sense? Traditional approaches to brow lifts are coronal brow lifts where you make a long incision across the top of the head and you go underneath the skin and the fascia along the bone, and then you disassociate the brow and you try to lift that whole piece up, skin included, everything goes up. The net result is you get a higher forehead, your brows look like they're in the middle of your forehead, and you just look different, you look surprised. Endoscopic brow lifts are just a less invasive version of that, but you're also disassociating the entire brow and elevating things basically as high as they can go, ultimately still leaving the brows looking different and unusual. Now, under that same sort of approach, there's a lot of different types. There's the direct brow lifts, a pre-tracheal brow lift. There's all these things. But let me be clear about this. The entire brow doesn't age and the entire brow doesn't descend. Because if you look at younger photos of yourself, you'll see that this portion of the brow, the medial portion and the central portion, are generally speaking where they used to be. And the reason for that is the muscles of the brow and the fascia are tethered to the bone in that section. But the corner of the brow, the lateral segment of the brow, is free to float down. As the face descends, it pulls the corners down. So my approach has always been to lift the corner of the brow using a lateral brow lift and not a full brow lift. Literally 20-something years of practice, and I've really never done a traditional or full brow lift for that very reason. It leaves the face looking refreshed. It leaves the face looking natural. When you combine it with work that's being done in the lower face and upper face, it just looks harmonious and balanced, youthful, fresh, and natural, which is, at the end of the day, what you all want.